What do you subscribe for eating?
So I usually tell patients I kind of have two pathways. I have their traditional pathway, and then there's kind of the non-traditional pathway. So the traditional pathway, we begin with lifestyle changes.
Yep.
So we say things like, really, I really harp on sleep because there are some great case studies as well as some data that shows that sleep is essential for testosterone production.
Okay.
So I tell guys that, you really need to be shooting for 7 to 8 hours of sleep.
Okay.
You have to, whatever it takes to lower stress in your life, whether it's altering your job hours, whether it's meditation, whether it's finding a hobby, some outlet so that you can decrease your stress.
Climbing rocks,
or what have you, working on cars, running, whatever it takes. And then exercise. I'm a really big proponent of resistance training.
Okay.
So big
Band training.
big compound movements like squats, deadlifts, things like that will raise testosterone. And then, diet and exercise types of things. So once we've really focused on the lifestyle, then we'll go into the pharmaceuticals. So there's the PD5 inhibitors. They all work pretty much the same. There's some differences with them, but generally I find that if a patient, like if one, for instance, doesn't work, it's not real typical that another one will. But, sometimes we'll cycle through there. But I usually use the common ones that are generic, so tadalafil and sildenafil.
Okay. Yeah, we have those.
I usually start out, I don't really start low and go high. I usually, start high and have them either like break the pill in half. Like, so if there's a 100 milligram sildenafil tablet, I'll usually have them break in half and go from there. Or if it's tadalafil, I'll do the 20 milligram tablet and have them break it in half. The guys that have some urinary difficulties, I'll do it like a daily tadalafil. Wow. So there is there's an indication to treat lower urinary tract symptoms.
So benefit there too.
So, and then there's some others that, to be honest with you, I don't think I've ever prescribed, like Levitra and Stendra.
Well, from my understanding, there's quite a bit of options out there for that stuff now.
There's definitely more out there. I'm sure it's more expensive. I mean, I haven't looked at this recently, but I don't think any of the literature shows that any one is better than another. I think the claim to fame for Stendra is like a 10 or 15 minute onset. I usually tell patients, kind of, what are you looking for? So a tadalafil has a longer half-life. Yeah. So it's kind of like nice, you could take it on a Friday and, it's still in your system by Sunday. But I also tell patients, if you're going to have a side effect, unfortunately, sometimes that side effect is going to be present for longer as well. Okay. So headaches are pretty common, really bad nasal congestion. Some guys will have like body aches. And then there's the sildenafil, which has a shorter half-life. So if you're going to have a side effect, it's kind of nice where, maybe you're only going to have a headache for, 4-hour period of time. Yeah. Type of thing. But then after, if those medicines don't work, it really depends. Like if you've got a guy that's somewhat healthy, that's not, morbidly obese, who's in his, 50s, maybe early 60s, generally they'll have pretty good luck with those. But if I got a guy that has like a really brittle diabetic who's... I mean, there's definitely some guys where you look in there and they're struggling just to breathe, just being in walking up the stairs to get to your office or something. Typically, they're not going to respond to the PD5 inhibitors.
They've got enough stuff going on in there that's messing it up.
So for the next step, and I'll throw in things like there's a vacuum erection device. Couple that with like a cock ring or something like that. But to be honest, I think I've only had a handful of patients who have actually repeatedly used a vacuum erection device, a penis pump. I mean, it's not real natural. It's kind of uncomfortable.
Well, at least you give them the options. I mean, a lot of doctors in situations like this would just prescribe and say, get out of my office. Yeah. I mean, and then oftentimes you'll combine it. So you can use the Viagra with the vacuum erection device or something like that. After that, it's injections. So penile injections, there's a bunch of stuff out there. Yep. The most common one is something probably called Trimix. And there's different, so it's 3 medications. There's prostaglandin, papaverine, and phentolamine. Okay. And there's different concentrations of each that the people will mix in. I don't know. I think don't you guys do? We do have some. Yeah, we have some instructional videos also online that you can check out on YouTube.
How to do it. Yeah. So I don't know what particular concentrations that you guys have or offer, but some patient might react a little bit better to one versus another.
Usually the injection of any type of supplement is going to work a lot better than the pill.
It's going to work in like 90+% of patients.